Yeah, that's a great question. And probably lots of people have a similar thing. We do have, so the nice thing about our practice, and we were kind of talking about this a little bit, is, if your risk factors change in the pregnancy or when you come in, a lot of times we can still be part of that care. It just might look a little bit different, whereas some practices it's like, too scary. So, we definitely specialize in normal and then recognizing when it becomes not normal or we need extra support. But there are things in our practice, there is sort of a list of things that would risk you out of our care initially. If anyone, had specific questions, I don't want you to talk about your medical risks, in front of a large group if you don't want to. So, if you wanted to come ask us, we could talk through that. Sometimes we encourage people, go ahead and, start care. Most things are like, we can get things going, and then we might talk about the best place for you to get those visits done.
Especially like if you're in the beginning and you're like, I don't know what I want, or you don't know that something might not be normal when you get that ultrasound at 20 weeks, right? Like, we're going to keep caring for you. And then if we find something that feels like we need to get a doctor involved, then we get the doctor involved. And it might be just a consult at first. And then they might decide, no, yeah, you really need to be seen by an OB. Okay. And then I talk to you about, do you want to see our collaborating physician who believes in midwives and isn't going to roll her eyes at you that you chose midwifery care and is going to support as much as you want through that. But she's a doctor. She's definitely a doctor. Or do you want to talk about, because I know you now through 20 weeks of pregnancy, I think you'll really like this lady downstairs because personality-wise, I think you'll just like her. But we're still there and we're still around, and we might even say like, come back to us postpartum, or I know that you had to have this, a doctor involved at your birth because something happened and this is the safest option, but you can come back to us for the GYN stuff. That doesn't mean that you're labeled high risk for life and those kind of things. Does that make sense? Or there's a lot of things that like might be in this pregnancy, you need higher risk care, but you might be totally fine with the next pregnancy or vice versa.